Let's go ahead and wake up Shamari this morning. Good morning, Shamari.
Good morning, Sandy. How are you?
I saw you getting into the song, boy.
Man, I was jamming, man. I was jamming. I need that for my household. Play that for the boys in the morning.
Oh, yeah, yeah. Listen, if you have any Alexa devices, just tell her to play the wake up song, and
I
that'll
don't I
get
don't
you going.
use Alexa, man. I don't use Alexa. I,
Oh,
I don't invite the FBI into my house.
no, no, no. You gotta have good security, but you can still use it. Good morning to everyone. How are you guys doing? Of course, today is Tuesday. So we've got our favorites in the house with Rundown Tuesday, Health City Cayman Islands. We're going to be talking about such an important topic today.
Definitely.
Diabetes. Wow, this is a scary topic because I feel like so many of us, Shamari, have this as a reality in our lives firsthand, or we've got loved ones who are struggling with a diabetes. You know,
No,
um,
definitely. And I
yeah,
mean, it's such,
situation.
such an important topic.
Yeah,
In the Caribbean, right? But
yeah.
also, hits close to home here in the Cayman Islands, and that's why we're always, pleased to be able to come on the program to share information, right?
Uh-huh.
It's Diabetes Awareness Month in November, so we want persons to understand diabetes, the symptoms, the types, the risk factors, and if you do have diabetes, how to deal with it. And we have Dr. Sandeep, who actually is with us from the very beginning. So one of the A team who was with us from the inception when Health City was here, what would be close now to 10 years ago.
Uh-huh.
So next April is our big 10-year anniversary, and we'll get into that in one of the programs in the new year. But so
Uh-huh.
glad to have Dr. Sandeep with us. He is our lead internist, and
Uh-huh.
really it's like a GP on steroids. So he
Uh-huh.
deals with, if you ever need to come to House City, not quite sure exactly what's wrong, a Dr. Sandeep is who you would see. And either he would help or he would be able to more or less put you to the physician and specialist that's needed. But he does
Uh-huh.
specialize in diabetes management and education. Also, he does interventional procedures, nephrology, and hemodialysis are areas of specialty for Dr. Sandeep as well. And if you've ever come for your executive health check, he is one of the
Uh-huh.
physicians that you potentially would see at the back end to help to explain everything for you and to carry it to the next level. And I know that Dr. Sandeep is well loved because I can't go anywhere. There are a few doctors that I can't go anywhere without people asking me how they're doing. And Dr. Sandeep is definitely one of them as well.
Uh-huh.
Sandy,
Absolutely.
you
Let's go
didn't
ahead.
ask me the question this morning.
Oh my goodness.
You
What was I
see,
thinking? What was I?
the long weekend. You're
I
not
know,
awake
I
yet.
know. All right. Well, tell me the good news. It must have been good news.
All right. So the good news is we were on a bye week this week, so that means
Okay.
we didn't lose. But the
Okay.
better news is all three teams in our division lost. So the
Oh,
Miami Dolphins are still on top of the division, number one in our division, going strong, getting ready
there
for the
you go.
playoffs. And yesterday was my anniversary, 13
Yes,
years.
I saw that. 13 years.
So,
Happy anniversary.
so strategically have my mug. I love my wife. Couldn't have the Dolphins today. Had to have my wife
Ah,
today. So
oh
my
my
wife
gosh.
gets
I
today,
love
and
it.
then hopefully the Dolphins mug will be out in fully fat next week.
Yes, I love all the Greece photos that you shared as well, by the way.
Ah,
Looking
you
good,
could
looking
tell that
good.
they were all from Greece, huh?
Yes.
Obviously, yeah. All of those landmarks.
Yes, absolutely. Well, happy anniversary to you and Michelle. I think it's so fantastic. I mean, I love to see people making these sort of personal milestones as well as the professional ones. So keep it going, keep it going. 13 years is fantastic.
So
All
now
right.
you've caused an issue, Sandy, because I have to go back and do the dress thing for her. Um, After seeing your pictures with the dress, she's like, "Why did I not know about this?" And
Oh
I was
my
like,
goodness.
the whole
Yeah.
thing. I'm like, "Look," and she's like, "Wait, you knew about this?" I'm like, "Well, yeah." But anyway,
I even wrangled Marlon in for a couple of shots. So
yeah, you got to share those.
oh God, no, he would kill me. He would kill me. All right, Dr. Sandeep, good morning to you. So good to see you in the studio this morning. How are you?
Morning, Sandra and Shamari. It's always pleasure to be with you guys
Yes.
to in the CMR. Very
Yeah,
good one.
absolutely. So of course we've got Stephanie. She says that you are the best. So she's
Hey,
glad.
Stephanie. Thank you.
She's glad
Thank you.
to have you here this morning. So, of course, I've definitely spoken to you as well there at Health City, and I'm one of those people who, watching my A1C numbers, this topic is of particular interest to me, and I think that all of us need to be so careful and make sure that we know our numbers. That's definitely the most important thing. So let's talk a little bit about diabetes this morning, folks. Do remember that if you have any questions for a guest in studio, Cayman Islands Health City, I see a lot of you here, almost 250 people on the live stream alone, and countless more listening on radio. The phone lines are open all the time, 936-2626. You can have your questions answered. And so let's start talking a little bit about Diabetes Awareness Month and what, today is actually November 14th is World Diabetes Day. So why is this celebrated around the world? Why is that, being knowledgeable about diabetes so incredibly important?
Yes, so as you know, the diabetes now it's like a major burden when it comes to health.
Hmm.
Every year, the numbers are doubling, with respect to the incidence and prevalence of diabetes in each and every country.
Oh, wow.
Why November 14th is considered as a diabetes awareness month is because the legend Sir Frederick Banting, who invented insulin, was
Hmm.
born on this day. So that is
Hmm.
the main fact where you consider this day as diabetes awareness month, for
Hmm.
that reason.
Uh-oh.
Hello.
Yes, there we
Can you
go.
hear me? Yeah.
Yes.
Yeah. So and then that many new additional management strategies and diagnostic difficulties which we'll be facing every year when it comes to diabetes. But the basic thing is very basic. If the population and people of any country have to realize that their health, when it comes to screening certain chronic medical conditions, should be done at a particular age without delaying it to prevent silent complications in a long term.
Hmm.
Uh, Diabetes is one of it, where you can prevent it when you come to know that you're getting close to it. uh, uh, when you it's called the condition is called pre-diabetes. As you know, most of the people will be in this pre-diabetes state for longer period of time, where this is a chance that they can just stay on there or revert their chance of getting into diabetes when they come to know what are the risk factors of progression of the disease.
Hmm. Hmm. Okay. Thank you so much for explaining to us the importance of today. So, of course, a lot of us, like I said, are struggling with this. And some people on radio are saying that they're having a little bit of an issue hearing you guys this morning. So, try to speak up as much as you can. I'm not really sure what exactly would be causing the issue, but you use your outside voice for today. You know how you tell your kids, use your inside voice? No, we want you to use your outside voice today. All right. Thank you so much, guys, for the feedback. We have pumped up as much as we can in our end the volume. So hopefully that makes a difference. Okay. All right. So, right. So, World Diabetes Day is today, folks. Let's talk a little bit about what diabetes is. I think a lot of us have heard the word for sure, but what exactly is it?
Yes, diabetes is a chronic metabolic disorder. When I say
Hmm.
metabolic, there is a hormonal disorder where the way the insulin is produced normally in the body is changed. Either it produces, the human body starts producing less insulin, or whatever insulin you're producing, it is not acting properly on the peripheral tissues to keep the blood sugars normal in the human
Hmm.
body. So everybody thinks that being sweet is good, yes, but not when it comes to the blood sugar. If the blood sugar is too high, it is not good, because each and every tissue in the human body including the diabetes can affect any organ in the body, including the skin. So it's that important to keep the blood sugars in the normal range, because the high blood sugars in the human body is toxic to each and every tissues, right from, as you see there in the slides, there can affect microvascular tissues like eyes, kidneys,
Hmm.
nerves, heart, brain, and also most of the other organs in the body, including the GI tract.
Hmm. Wow. So, this increase, we often call it sugar, is one of the terms that sort of the layperson calls it. But this blood glucose, insulin issue can basically affect every major organ in your body.
Yes, yes, it's rightly said. So the important ones which gets affected very early
Hmm.
are microvascular tissues in the eyes, brain, heart, and kidneys. These are the four important aspects. Yeah, the eyes and kidneys go hand in hand. So whenever the eyes are affected, your kidneys are equally affected at the same time. Um, these are the microvascular complications where you would not have any symptoms, knowing
Uh-huh.
that no, you this is happening. So if you have to prevent these silent microvascular complications, you have to keep your blood sugars in the normal range. Most people do not understand, oh, why we have to treat it, because you don't have any symptoms. You cannot wait for symptoms, because if you're waiting for symptoms of florid uncontrolled diabetes to happen, it is too late, where you would have had maximum microvascular and macrovascular damages in the tissues. Yeah.
Hmm. Hmm. Wow. Okay. And even some types of cancers? I was a bit surprised to learn that. That's new to me.
Yeah, there are a lot of associations. They try to link it. This requires a lot of studies, as you know, a lot of large scale studies to correlate and say, what is the association. Yes, some cancers, including the GI tract, colon cancers, rectal cancers. All of these is
Mhm.
associated. Some of the rare type of endocrinal syndromes are associated with these cancers, which are called familial cancers.
Mhm.
So not particularly any sporadic cancers, and not very common, but a very rare familial cancers are associated with endocrine problems and diabetes.
Hmm. Wow, quite shocking. All right. Folks, don't forget if you have any questions, 936-2626 is the telephone number. So we know that there are commonly two types of diabetes. So let's talk about the first one, which is type 1 diabetes.
Yeah, I mean, it's not two actually. They broadly classify now as three. The third
Oh,
one is the diabetes which affects during pregnancy. It's called gestational diabetes. And now in this
yes.
modern world, yes, that is also one of the important cause, because of the prevalence of obesity. So there's a strong correlation between obesity and type 2 diabetes, and hence during the pregnancy also the insulin resistance is very common. um, so one is type 1, type 2, the last one is broadly classified as gestational diabetes. When I
Mm-hmm.
say type 1 diabetes, it was earlier called as insulin dependent diabetes. When the second one comes, it's a type 2 diabetes, which is called non-insulin dependent. These terminologies have been taken off now, because the type 2 diabetes, people with type 2 diabetes may also start needing insulin at the later stages of their life, if they progress. So type 1 diabetes is the least common type of diabetes. You often don't see this one. It accounts to just 5 to 8% of the world's population have this type of diabetes. It
Mm-hmm.
is more brutal to have this type of diabetes, because what it means is that your pancreas, one of the important endocrine organ which secretes insulin, just gives up, and then it starts producing less in some people for some time, and then all of a sudden it just stops.
Mm-hmm.
So the main reason behind this is a familial. And I say familial, it's a lot of complex genes, which I cannot say one or two, with
Mm-hmm.
autoimmune process, where your pancreas is completely suppressed. with not producing insulin. So this is like a very bad thing which happens. And very unlucky. Most of the type 1 diabetes people needs a high dose of actual insulin requirement, like 1 unit per kg per day. Like they would need some 60 to 80 units of insulin pumped in every day to survive. That is what type 1 is about, and more complications are associated with type 1 if you don't tightly control it. And for certain reason, the risk factor, I mean, the complications are um, very vast and major. In fact, most of the kidney failures and eye damages are all associated with type 1 diabetes. Um, as is the presentation age would be in from adolescence age, like teenage group and 18, 19, 20 years. This is the most common age where it presents. It's not uncommon in children as well. There is another
Mm-hmm.
classification for diabetes in pediatric and children group as well when it comes to type 1. Different type of, there's another component called maturity onset of diabetes mellitus, MODS. It's called MODS. A lot of subclassification will come when it comes to type 1 diabetes. And the most common one, which we all are worried when we should be more talking about, is the type 2, because 90 to
Mm-hmm.
95%, I would say more than 95% of the whole world, if they get diabetes, it is this one, it is a type 2. When I say type 2, it's just a classification of telling that, oh, you have this, you have, or you have that. So
Mm-hmm.
type 2 means, you are producing insulin, but the insulins fail to act properly. Fail to act properly onto certain on certain tissues and organs. Basically, what happens is when you produce insulin, the insulin has to make the tissues in the body to
Mm-hmm.
consume the excess glucose and keep it normal. So that's a normal phenomena. When this phenomena is affected, you'd start having high blood sugars.
Right.
So initially, you would not need any insulin to treat it, but yes, you need some medications. More than that, active physical activity, including aerobic exercises, changing your diet to decrease the sugar surge and the carb factor, which pushes the glucose higher and then makes your body more difficult to control it. So it's basically the diet, exercises, followed by certain medications. It's called oral hypoglycemics.
Mm-hmm.
There are many classified drugs. The important, the gold standard, the number one, always talked about is metformin. As you know, it's used here.
Yes.
What it
Mm-hmm.
does is, um, it's gonna decrease the insulin resistance by sensitizing some of the receptors which take in more glucose, which is high in the body, and decrease it. So there are many actions of the metformin. So basically, it decreases the insulin resistance and increase the way the insulin functions for type 2 diabetes. Gestation diabetes is mainly because of other factors. Sometimes it's family related, obesity related, when pregnancy. So these are the people who never had diabetes in their life,
Mm-hmm.
but as soon as they are pregnant, so it's more common when they cross first and second trimester, means more than one third or one fourth period of the pregnancy when they cross. So they have to do a test called in they do a 1 hour, 2 hour, 3 hour glucose test. It's called a GTT, glucose tolerance test.
Yeah.
So
We've been there.
many, you've been there. And yeah, now that the glucose tolerance test, we don't use it to diagnose type 1 or type 2, but only for the gestation for now. Um, it also indirectly says, how is the insulin resistance pattern. Sorry.
Mm-hmm.
So, yeah, with the gestation diabetes, basically, it's because of the increase in surge of another molecule similar to glucose, which is secreted by another organ from the uterus. It's called a placenta. Placenta is a main lung for a baby. It's a main lung. When the baby is in womb, fetus is in womb, so you don't have the lung functioning. It's a placenta
Mm-hmm.
which breathes. So the
Mm-hmm.
placenta is another mini pancreas like organ inside the uterus, which
Mm-hmm.
produces certain hormones. When it increases certain placental hormones, it's going to increase the blood sugar indirectly and cause diabetes.
Hmm.
So, well, there are many impacts when this happens in pregnancy.
Yes.
It can affect right from fetus very badly. It's called a high risk pregnancy when people have gestational diabetes,
Mm.
because it can have deleterious complications during the delivery on the baby, increased risk of sudden deaths in fetus because when they have gestational diabetes. So all of the obstetrician know how to deal with this. Invariably, they would need insulin if it is very bad control. Most of the time, medical nutrition therapy (MNT) is a treatment for this. Just being more cautious, what type of exercise you can do in gestational diabetes, and all of that will help to decrease it. So, 2 to 10% is a big number when it comes to
Hmm.
the
Hmm.
incidence of this type of diabetes. So, it is also important to talk about because it indirectly or directly affects the fetus very badly. Now, the good thing about this is as soon as the baby is delivered, I mean, the placenta, the organ which is attached to the baby, when placenta and the uterus, I mean, and the baby comes out, the blood sugar falls down, and you would not be having any problem after that. But there's a catch here. There's 8 to 10% chance that the gestation diabetes, people who have gestation diabetes can have type 2 diabetes in the next 3 to 5 years. So they have to be monitored. They have to be monitored. This is about
So it,
third.
it predisposes you to then getting type 2 diabetes, basically.
Yes, yes, yes. That is the reason, people who have been told that, oh, you have mild diabetes during your
Mm.
pregnancy should always monitor for the next few years. Yeah. Not everybody will get it, but some will have that potential risk.
Hmm. Wow. Okay. And of course, just because you haven't had it also doesn't mean that you shouldn't continue to monitor all of your numbers post pregnancies and stuff as well.
Yes, yes. Always, when you're at certain age, more than 35 or 30, with risk factors from family, family risk factor is a very strong risk factor. If your parents are diabetic,
Hmm.
you should be always watchful about you getting it in a pre-diabetic stage. So the screening should be starting very early, like 30 to 35 years of age, depending. It depends on, like, your lifestyle, your risk factors, like how it is mentioned in the screen there. These are the main risk factors for type 2. Um, yeah, based on that, they say, 35 years is the most common age, but we have had type 2 diabetes right from 22, 23 years, 27 years. So it's not always that age which dictates. Type 2 is also common in younger age, in early teens and 22, 23 years, because of the vast risk factors, the obesity being the prime risk factor for that.
Hmm. All right. So just to let our radio listeners know, we've pumped up our guest volume as much as possible, 200%. So if you can't hear him now, might be hearing aids, but we've received your feedback, folks, and I've done as much on my end. I'm not really sure because I'm hearing him perfectly fine. So of course it doesn't matter what I'm hearing. You guys need to hear him as well. So we've pumped everybody up to 200%. So let's hopefully see if that will assist. So, folks, in case you are just joining the show, we are talking about diabetes this morning. Such an important topic because I feel like a lot of us are either sort of monitoring our diabetes or we are, having to deal with family members who have it. So, yes, a very, very important topic to learn about. So, I've already learned a few things here this morning. So, we're now discussing some of the risk factors, everything from physical inactivity. Why is exercise so important to controlling your glucose levels?
As you know, exercises helps us to burn calories. That is a first thing. Bringing down calories itself will decrease the requirement of the tissues to utilize more glucose. That is the first thing. Second thing is the insulin resistance, which I was talking about, decreases when you shed out more fat from the tissues. That's another factor. And if I had to explain it to you in a very simpler way, the fat layers under the skin are the intraorganal fat. These are the ones which has to be taken off for the insulins to act properly.
Mm-hmm.
So those are the two important, mechanism of action. There are other ways of decreasing the insulin resistance when it comes to aerobic exercises and physical activity. They say at least 20 to 30 minutes of brisk activity,
Mm-hmm.
out of 5 days in a week is recommended, both for your cardiac health and also for this prevention of diabetes.
Mm-hmm.
Mhm.
Now, let me ask you a question about the exercise element, right? Is it important to do a little bit of something every day? I was reading a study recently that was showing that even if you get up and do just 5 minutes, like you take breaks and do some kind of, just squats or whatever, lift a couple bits of weights here and there. If you do that a couple times throughout the day, that adds up and you get the same benefits versus going out and walking for 30 minutes or exercising for longer blocks of time. What is the emergent research actually saying about that? And can I do, 3 times a week where I go really hard, intense, or should it be every single day? What's the best recommendation?
Sandra, as you know, the requirement for any person to be healthy is different based on his risk factors.
Mm-hmm.
So, as a healthcare professional and doctors, we always say whatever you do, we accept it. If you just do once a week, once in 10 days, so
Mm-hmm.
whatever
Good
you
enough.
can do, the physical activity is always beneficial, not only for the diabetes prevention, but also for your general health, for your mental health, sleep, improving the sleep and relaxation and all of that. So
Mm-hmm.
physical activity is very important. It might be 2 days in a week, 3 days in a week, all days in a week. If you can do it, it is best advised for to do at least 5 days in a week.
Mm-hmm.
But as I told you, anything is acceptable
Mm-hmm.
when it comes to the exercises and physical activity. Yeah.
All right, so just get it done. Other risk factors, of course, we mentioned the excess weight, which doesn't help, or obesity, and a family history of type 2 diabetes. Now, how close of a family history are we talking about now? Does it have to be like parents, or if I've got like uncles and aunts, is that close enough that I should be worried as well?
The prime risk factors would be from the immediate relatives, the first degree relatives. It's always the parents and the siblings who
Yes.
gives the maximum risk. Yes, there is some remote risk is also considered, but it should be associated with other medical problems also. Like if there was a cardiac issue or a complications that happened in your grandparents because of diabetes and all. So that is still considered as a prime risk factor. The cardiologists still take this as a risk factor from the second degree relatives. But what we have to be aware is that if your parents, basically, if parent, that's a very strong risk factor. Let me say this, a
Mhm,
very strong risk factor. No matter how healthy you are, how thin and lean you are, and how healthy you're eating,
mhm.
your risk factors from the family, immediate family members, dictates that you might get it or you might have progression of diabetes.
Wow. Hmm. Very, very interesting. All right, folks. And of course, being over the age of 40, what happens to the body as you start to get older that impacts things like insulin resistance and so on?
Yeah, so the incidence and prevalence of diabetes increases as you grow older. So it's
Mhm,
as simple as it is. There's an entity and term called late onset of elderly diabetes, where there's mild insulin resistance, which starts at the age of 65, 70, 80 years. That's basically the pancreas starts getting atrophied and fails. Um, so yeah, it's basically as your age progresses, the risk factor exponentially, increases with respect to the diabetes onset.
mhm,
Of course, the other risk factors also associated with it, and not only the age.
mhm, mhm. Hmm. All right, folks, 936-2626. The phone lines are open. If you have any questions, please feel free to give us a call. Let's just go in the comment section and see some of the comments that are coming in this morning. Good morning to Strong Wilt. Says, good morning, Sandy. Dr. Sandeep is one of my doctors and he's the best. Big up yourself. Thank you so much. I'm sure he appreciates that.
Thank
Perla,
you.
good morning to you. Um, Tisha, good morning. Says, it's such a privilege to have Dr. Sandeep here in Cayman. He's amazing. I appreciate him so much.
That's wax, Trisha.
Jennifer, we got some Dr. Sandeep love this morning. Jennifer says, my favorite doctor.
Jennifer, hi. Thank you.
Evelyn chimes in, says he is the best. He's the one that's keeping me on track with my health. Very, very good, Evelyn. Debbie says, what does Dr. Sandeep think about being on the sliding scale with insulin? So tell us, what is this sliding scale?
Yeah, well, there is an entity called brittle diabetes, where your insulin requirement is not fixed, like how much you need. Especially this is a challenging situation where families face to treat people who are who elderly, elderly people who are diabetic in their home, to give insulin with a fixed dose. That the prime factor is the way they accept the food is not same. They may not eat breakfast on time. They would say, I'm not hungry, I don't want to eat food. The skip meals, whenever they skip meals, the body gets confused. The insulin goes, like, it goes very low at some point, and then the next few hours it goes very high. So it needs, it's a challenging situation where we give a scale and write them, and say that, if the blood sugar is between this much and this much level, give this units, like this much units of insulin. So they check blood sugar every time and give insulin according to the blood sugar, so that they are safe and they don't need to fix a dose. So that is called a sliding scale for the insulin in home. So I have to appreciate all the family members who take so much of efforts to, help their diabetes patients, diabetes family members, keep the blood sugars under control. Because when it gets too low, it's too dangerous. When it gets too high, also it's too dangerous. So that's a problem with brittle diabetes.
Hmm. I want to ask you something. You're talking about when people skip meals. So, of course, this intermittent fasting has kind of been, a thing lately. And there seems to be some confusion about whether or not someone who is not necessarily diabetic, but in the pre diabetic stage, is intermittent fasting something that can be beneficial to them? Or do you recommend the traditional eat small meals incrementally during the day? Don't skip breakfast, eat maybe something every couple hours to kind of keep your insulin levels steady. So what's the if you're not yet diabetic, you're in the pre-diabetes, I know that intermittent fasting is something that a lot of people rely upon in order to lose weight. So it can be helpful with weight management, weight control, which of course is one of the risk factors. But is it something that you can do if you're pre-diabetic? Is it any evidence to prove that it will help those individuals as well?
Yes, this has been a there have been very extensive studies nowadays done for intermittent fasting. The major benefits of this would be related to the weight, actually. So how it prevents diabetes is indirect effect when you lose weight. So it do not have a direct effect on the blood sugars. In fact, it's a little difficult for people who have diabetes to do intermittent fasting, because they might experience very low sugars, if especially if they're manual laborers and then they work a lot, and they do walk a lot and all of that. So it's an indirect effect from the weight loss, which helps for the diabetes. So the
Mhm,
most of the studies, including the Journal of Clinical Nutrition and Oxford's and weight loss societies all over the world, it's basically for weight. It's
mhm,
basically for weight. All the benefits you get by losing weight, you would be, indirectly, it would be indirectly helping your diabetes as well, for
mhm.
prevention and to help. Yeah.
Very good. So we've got Miss Linda. Good morning, Miss Linda, joining us from Bermuda. She says, "Good morning, K-Man. Love the diabetes information." She's a new fan of the show, joining us every morning now. Appreciate you, Miss Linda. And I think Paul, also from Bermuda, is also tuned in. So another interesting thing here, one of the risk factors, you talked about medication such as steroid use for a long time, gestational diabetes, which we have discussed, um, is high blood pressure. So all of these things seem to be sort of interconnected, the obesity, the high blood pressure, the diabetes. So what's the connection between high blood pressure and diabetes?
The connection is not very strong. So about they say up to they just goes by incidence. You know, that two-third of the population all over the world who have hypertension also have mild onset of diabetes or diabetes associated with it. So it basically increases the risk factor to have a heart disease, a heart attack, or a stroke by 3 to 4 times when you have this deadly combination. So there is no direct link like people who have diabetes will also get hypertension. It's basically as you know, the hypertension or the blood pressure in layman terms. So we call in medical terms as essential hypertension. It's called essential because you do not have a cause for it. You do not have a cause for it. So it's so complex that you don't know why it happens. It's just that as you grow older, your arteries become more stiffer, and the blood pressure starts raising slowly. Um, uh, there's no direct link that people who have hypertension will also have diabetes,
Mhm.
but it's an associated factor when you grow older. If you have both of them together, of course, it increases the risk factor to have heart attack and strokes and kidney problems because both of them affects these end organs differently when it comes to long-term effects. Yeah.
Mm. And of course, the big elephant in the room, those of us who are Asian, African, Caribbean, Black Asian background, African Americans, there's also a link there, I guess, based on race. I don't know if that's the correct word for it, but you know what I mean? So tell us how, why is it that we are more likely to be impacted by things like diabetes, high blood pressure, and so on?
Yeah, the South Asians, Black Africans, and some of the African Caribbeans. These are the ones who have high risk for type 2, high risk
Hmm.
for type 2 diabetes. It's basically because of the ethnicity risk factors what they have from the family risk, plus the type of diet which they do eat. As I know, all of my uh, countrymates and South Asians, like Indians, Philippines, Pakistanis, and all of most of the people from Singapore, Malaysia, and the staple food is always rice related step. It's a rich carb, and the same thing is true for the Caribbean. What I've seen is here, the Caribbean is always when you go somewhere, you always see a lot of uh, carbs and starch as a major component of the meal. So yeah, it's just increasing the risk by pushing your blood sugars too high, so that blood sugar surge will increase the risk of getting type 2 diabetes.
Hmm. Wow. So all the rice that we love, the rice and beans, the potato salad, the macaroni and cheese. Like honestly, when you see a traditional, I know Shamari can testify to this, especially Christmas is right around the corner, and Thanksgiving. You'll see a plate of food of traditional, a Caribbean plate, a Caymanian plate of food, and we've got meat and starches, and maybe a little circle of vegetables, and then that's it. So we need to balance that out and have more healthier options on our plates. Yes.
And then we go back for seconds, right?
I know. I know. Then we hit the dessert table.
That's another plate.
Yeah, the non-starchy carbs is what we have to include more on our meal plates. When I
Hmm.
say non-starchy carbs, it's all these broccolis,
Hmm.
cauliflower, greens, peas, Brussels sprouts. So they
Hmm.
are starches. They are,
Yeah.
they are carbohydrates, but they're not starches. So
Uh-oh.
Oh, I think we lost Dr. Sandy.
No, 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 no. I've been getting too many calls. I'm sorry from the hospital.
Oh, okay.
Sorry for that. I'm using my phone. It's 8 o'clock.
Yeah.
So,
Okay.
uh, yeah, this use of non-starchy carbs are the one we have to replace the starchy carbs like white rice, white pasta, potatoes. Three important things when it comes to Caribbean
Mm-hmm.
food: the rice and beans which we eat. Uh, yeah, I mean, you can always have that, but in smaller portions.
Yes,
And
yeah.
especially people who have risk factors, you know that you're getting into a phase of pre-diabetes, or if you have strong family risk, or if you have those obesity as a risk factor, and you're physically inactive, you have to make
Mm-hmm.
these changes in your diet as a first as a first thing.
Yes. And I watch a lot of content to try to educate myself, and there's some really wonderful folks on YouTube who are also diabetes experts, and they talk a lot about the importance of diet, controlling that. And the one food which is so hard that they've said that if you had to say there's one food that is really going to impact your insulin resistance and so on, and that you could cut out probably forever, it is the potato. And I was like, ooh. So any form of a potato, French fries, baked potato, mashed potato salad, how else do we do potatoes? We have so many different recipes for potatoes, but it said that if you could actually, get rid of potatoes from your diet, that's like the one food that someone who's suffering or pre-diabetic or trying to control, this particular issue, that you should never touch. Like if there was a you know, put it in the bad corner, don't ever touch it. It would actually be potatoes. And that is so hard, I think, for people to do because there are so many dishes surrounding potato, right? It's such a staple food. And we have so many different types of potatoes. We've got sweet potatoes. And, I love the little miniature, they're like purple potatoes and they're really good in curry chicken, actually. You just throw them in there and they're filling, but yeah, folks, eat more healthy stuff like the broccoli, cauliflower, and those types of things. So let's talk about some of the symptoms. Good morning to Juliet. I see Miss Joy San is here this morning as well. Strong Wilt says that he misses Dr. Ranja, but thumbs up to Dr. Sanjeev. So, all right. Debbie says to replace white potatoes with sweet potatoes. Well, apparently there's no real that they what's the glycemic index? So let's talk a little bit about this, Doc. Apparently foods are sort of categorized and whether they have a high glycemic index or low glycemic index, and then that determines whether or not it's something that you should sort of incorporate into your diet. And I understand that again, even a sweet potato might be a little bit lower than a white potato, but it's still pretty high, right? How do you know, what is healthy? Do you just have to go by the rule that you just said is eat things that like cauliflower, broccoli, anything in that family is actually considered to be quite healthy for you?
The glycemic index is a way of determining what food has, how much risk of increasing the blood sugars very quickly.
Mm-hmm.
So, especially in that 2 hours of period of time where the stomach takes time to push the food out of the stomach, it's called a gastric emptying time. Basically, it's the same thing. The carbohydrates and complex starchy carbs are the one which has got the highest glycemic index. Of course, the all the Gatorade and the good Gatorade with a lot of sugar and sugary drinks, Pepsi, Coke, they top the list of
Mm-hmm.
being at the highest glycemic score.
Mm-hmm.
The lowest glycemic index food is again the same, the healthy food which you are talking about, like all the green leafy vegetables, most of the fruits, excluding some of them like mangoes, sweet melons,
Mm-hmm.
and pineapple. They have the high glycemic fruits.
My
So
favorite.
yeah,
Oh, it's challenging during mango season, and I don't like necessarily ripe mangoes, but it's not the sugar content; it's the starchy content. So even I have been told that even though I'm eating them not ripe, they're kind of like what we call churn mangoes. That's still a problem. So it's still, it shouldn't be the fruit of my choice because just because it's a fruit, doesn't mean that it's healthy. Like one of the things that I was really, really surprised to learn about is, sometimes we like to have a snack and we'll eat dried fruit. Apparently, dried fruit is not normally a good idea at all. Like the dried raisins and like dried bananas and whatever. Oh gosh, there's just so much out there to learn. Why that's why I love these segments. We can break it down and it's not too overwhelming. So let's talk about some of the symptoms. And I think one that I definitely, there's a couple on this list that, everybody's kind of watching, but feeling very thirsty, frequent urination, especially at night. Yikes. Feeling very tired, weight loss and loss of muscle bulk. Um, this one says itching around your privates or frequent episodes of thrush. I never heard of that before. Is that because what would be causing that in relation to diabetes?
Yes, all these symptoms which you see on the slide there, these are all the symptoms of full blown type 2 or type 1 diabetes. It's because the high glucose in the blood, if it is constantly present,
Mhm.
it is going to increase the kidney point of view. It's going to increase the way the diuretic effect happens because of high glucose levels. You start peeing more, polyuria, polydipsia, and polyphagia. You drink more, you pee more, and you eat more. Even
Oh,
if you have eaten a good breakfast after 2 hours, you get more hungry. So these are all the symptoms of full-blown diabetes. Your blood sugars, usually, if you check it at this period of time when you have these symptoms, would be always more than 250 or 300. Definitely about 200 all the time. And of course, when your body's metabolism requirement will increase, you feel more tired. You pee a lot. You might get dehydrated. Those are the symptoms where you feel tired. Weight loss, yes. Uh, when the blood sugar is too high, you would start losing weight in 2 to 3 months of period of time. This is the effect of high blood sugars on the tissues. So one of the presentations commonly seen in OPD for the first time is people come with unexplained weight loss. They say that, I don't know why I'm losing weight, and they become very lean. They've lost some 20,
mhm.
30 pounds in the last 3 months. So we always test them for diabetes, and invariably they would be. So when it comes to itching at the private parts, it's again the incidence of fungal infection increases to 3 to 4 times when you're diabetic, because it's just as simple as it is. The blood sugar levels, increasing glucose levels, attract more infections. So it's all the itching. Wherever they say it's all itching, itching. It's all because of candidiasis and tinea and all those fungal infection in those areas. Um,
Mhm.
yeah.
Wow. All right. So Debbie has a question. She wants to know when is the best time to take your sugar reading after you eat. Now, I just had a cousin who got one of these sugar monitor, like the blood glucose monitors, I guess, that's constantly on you. And you can have a look at, and she's already said that she's seen some patterns, like hers is dipping at 5 o'clock in the morning when she's still sleeping. She gets to see a lot of these patterns. So I want to answer Debbie's question first. And then, is it a good idea to get these monitors, even if you're not yet a diabetic? Should you be watching your sugar like that constantly, or how do you know who should be, fitted for one of these constant monitors?
The ADA, the American Diabetic Association, which is a main organization in US, which gives us guidelines for most of these diabetes treatment and management, do not recommend to use CGM, continuous glucose monitoring, for everybody
Hmm.
who is diabetic, because it's just for the simple fact that it's very expensive to do that. Most of the people do not afford to do that because you have to change those sensors which you apply on the skin and leave it for 2 weeks. And the machine itself is an expensive thing. It's linked through the Bluetooth to a machine which continuously gives you the graph of the blood sugar readings.
Hmm.
This is usually used in people who have brittle diabetes, or too difficult to treat diabetes or type 1 diabetes where your blood sugar levels are very high and you require a very high dose of insulin
Mm-hmm.
to just to prevent the deleterious effect of hypoglycemia, the low sugars. So, to prevent recurrent or hypoglycemia induced complications, you use the continuous glucose monitoring.
Mm-hmm.
Um, and also it's also used in children with type 1 diabetes or very elderly people who live alone or who live alone for a few hours in a day where you need to be constantly seeing these numbers, make sure that it doesn't fall too low. And these are the situations where you use CGGM. Otherwise, in other countries, actually, the insurance do not approve to get these monitors and sensors uh, uh, through the insurance, actually, if it is not indicated.
Mm-hmm. Okay, so some treatment options include insulin, tablets and medication, weight loss programs, diet and exercise. So, can we talk about the elephant in the room when it comes to treatments, which is the metformin and not metformin, sorry. What's the one that they've been taking recently with the weight loss drug?
Zepic.
Ozempic, sorry, yes, Ozempic and Ozempic style. There's a few other, sort of brand name drugs that fall into that same category. That is supposed to be a drug for people who are diabetic and helps them to control their diabetes. But it seems like there is this off effect of people having some sort of rapid weight loss as a result of it. So people who are not diabetic have been taking this drug for the sole purpose of weight loss. Is that a good idea?
Um, yeah, I mean, these are the different molecules. Every year, different molecules come up when it comes to treatment for type 2 diabetes.
Hmm.
These injections which you're talking about, called Ozempic, is marketed all over the world in different trade names. In United States, it's also available as Wegovy and another one which I forgot the name. Basically, the drug which is there in it is called semaglutide, which is GLP-1 analog. It's one of the receptor which is present in the human body, on the pancreas, on the hypothalamus at the appetite center. So it usually modifies the way the food stays in the stomach and increases the gastric emptying time, so that sorry, it decreases the gastric emptying time, so that you feel a sense of fullness all the time, and it does cut your appetite through the hypothalamus appetite centers, and also by decreasing the gastric emptying time. And of course, yeah, it has to produce some insulin also. It's going to, stimulate the pancreas also to produce more insulin, so that it helps for the blood sugar to come down. It's a complex mechanism, but a very good suggested drug for people who are having type 2 diabetes with obesity,
Hmm.
when they fail the initial, oral hypoglycemics like metformin and other associated medication that can be used. If they are at higher risk for heart attack or they already have a heart disease, it is primarily not advised.
Hmm.
And when it comes to weight loss, yes, for strange reason now, when it comes to weight loss, everybody tries to be using some magic drugs where you can just inject or take and sit in home and do lose weight. So yes, this was approved in US. I'm not sure about the current scenario, but couple of them with the same molecule with different brand name. Vigo is definitely approved for weight loss in US, where the insurance approves it in some states, but not here though. No, isolated weight loss recommendations are not there yet for Ozempic, but still people want to try it and insist doctors to write the prescriptions saying that they would pay out of pocket to take it. Well, then as doctors, we have to be safe enough to explain the risk factor, I mean complications, and the long-term effects, and also make sure that they have some indications to take that and just not give it for obesity per se, for the weight loss per se.
Hmm. Okay, couple questions coming in. So this person says, "What are some food tips for people who are on the cusp of stage two? I think they meant type two diabetes and insulin resistance due to PCOS, where it's more hormone driven. Um, does it? I mean, if you've got these sort of pre-existing things like hormone related issues, familiar related issues? What can you do by way of your diet to perhaps counter that? Is there any separate advice different from what you've already said? Or is it the same sort of, advice in terms of what you can do?
Let's talk about PCOS. A polycystic ovarian syndrome is a very common entity, which
Mm-hmm.
which is prevalent in adolescent and young women. It stays on and causes problem till 40, 45 years of age. When it comes to fertility, the regularization of the periods, and all of these is important when you have to conceive.
Mm-hmm.
Uh, so the PCOS, the risk factors, again, it's the main risk factor, and how it increases the insulin resistance is by obesity factor. Of course, it's recommended. Exercise is the first treatment. Exercise and physical activity to lose at least 10 to 20% of the weight is a prime treatment for PCOS, or polycystic ovarian syndrome.
Mm-hmm.
Um, of course, those who are at risk factor for pre-diabetes, or they're at higher risk for diabetes, all of them, they recommend using metformin also. It's prescribed basically to decrease the body's sensitivity. I mean, to increase the body's sensitivity to insulin, which in turn improve the blood sugar levels and reduce the androgen levels. Androgens are the ones which are elevated in polycystic ovarian syndrome, which regulates ovulation at the mid of the cycles.
Mm-hmm.
Decreasing the androgen functions and balancing it is what the metformin does, and it is approved for PCOS in certain situations, not for everybody who have PCOS.
Hmm. All right. So Miss Stephanie says, I'm a diabetic and listening this morning. I've gotten so much information from Dr. Sandy. So beautiful. All right, folks. Living with diabetes. So it's something that can be managed if you have it. It's not a death sentence, Doc. What do we need to know about how to live with it?
Screening comes becomes an important part, because always, prevention is better than cure. Screening. If you're screened earlier, you'll come to know what are your risk factors, and you can always prevent diabetes or push diabetes to no, I don't know how many years. You can just be more vigilant about getting away from it. So losing weight, exercising more, and eating healthy is the three important prime factors, as you all know, which will help in preventing diabetes. People who already have diabetes, or who are about to get it with high risk factors, they should consider getting down the weight. As you know, weight is a prime factor. Obesity has been the number one risk factor for type 2 diabetes.
Mhm. All right. So quit smoking, cut down on alcohol, or eliminate it completely if you can. Manage your blood pressure and cholesterol levels. Excess weight, try to get that off. You can certainly do that by exercising as well. Maintaining a healthy diet, cutting sugar and refined carbs, and pay attention to portion sizes being so incredibly important. So, Dr. Sandy, we know that you're extremely busy, and as the time goes on, it's now 8:37. You are tied up, so we're going to go ahead and thank you for coming onto the program today. Such a fantastic discussion. We really appreciate all of your expert advice. Shamari, any final thoughts this morning?
No, just want to thank Dr. Sandeep as always for taking time out of his busy day. And as you can see, I wasn't lying. Look how many people love Dr. Sandeep. That's
Yeah,
writing in.
Thank you all so much.
yeah.
And just to also remind people that they can get their lung cancer screening, $50 US. You have to be 50 years or older, have a history of smoking equivalent of a pack a day for 20 years,
Mhm.
or you're a current smoker, or one who has quit within the last 20 years. So definitely call us 640-4040 or info at healthcity.ky. You have to book it before the end of November and take the appointment before the 15th of December. So your
Mhm.
lung cancer screening, definitely come in for that as well.
Right. And one quick final point before you leave, Dr. Sanji, touch on the A1C test and why that's so important in diabetes management and, just making sure that you're monitoring that number.
Yes, I was talking about the screening of diabetes. When I say screening, so we do this test, which include another fasting glucose level with that. So with 8 hours of fasting with no calories, but you can drink water. You come to the hospital in the morning time to give the blood sample to test for blood sugar in a fasting state, plus a test called glycosylated hemoglobin. It's called HbA1c. It's called HP because it is measuring the amount of glucose molecules which is attached to the hemoglobin, which says the last 3 months how much glucose is sitting on your hemoglobin, which indirectly tells us that, oh, in the last 3 months your blood sugar is constantly high in your blood. So that tells us how close you are to the diabetes, and it also helps us for the diagnosis. So when it comes to the levels, so anything less than 5.7 is considered as normal. So anybody who is in between 5.7 to 6.5 is considered as having
Mm,
pre-diabetes, and whoever who has more than 6.5, we'd say that they have type 2 diabetes.
hmm. Wow. All right, folks, knowing your number is extremely important. Thank you so much to Dr. Sandeep. Thank you so much to Shamari, both from Health City, Cayman Islands. You guys have a fantastic day.
Thank you so much, Sandra. As usual, it's a pleasure being here. Thank you.
Thank you. All right, folks. Yes, that was incredibly useful information. I know I learned a lot. This is one of the areas that I'm monitoring personally for myself, and I think we all need